And I'm the CEO of Access Community Health Network. We'd like to give you a warm welcome to the mayor and my fellow healthcare leaders to Access. You're actually standing in our Center for Discovery and Learning, our NIH-funded translational research center that serves as an innovation incubator to really foster new thinking and solutions to increase health equity across our communities. At Access, we provide a continuum of care model that really connects patients to healthcare resources, both within and beyond the walls of our health centers. And as we primarily serve at Black and brown communities, we have seen firsthand how the past few years have really seriously escalated the trauma our patients face, especially our children and teens. Therefore, with critical funding from the Chicago Department of Public Health, Access has been able to deepen our understanding of how trauma-informed the process will be able to expand our support for pediatric patients and their families by providing behavioral health care and psychiatry integrated into a preventive and physical health care model. We already provide ultimately we know will improve the health outcomes. Our care teams are able to really devise a holistic care plan that really helps the child who is living with the trauma of domestic violence in their home, the parent who needs support navigating the schools for ADHD treatment, and also the teen with body image issues facing bullies on social media. With a trauma-informed approach, we can improve the quality and impact our programs and services while strengthening our environments to be emotionally and physically safe for patients and staff. And since the launch of our trauma-informed pilot program in January of 2021, at sites like Ashland, which is really across the way from this building, we have directly impacted hundreds of patients between the ages of 5 to 21 years of age who have received that critical support. All of us standing here today is really committed to address trauma, and with the support of the Chicago Department of Public Health, we will continue our journey to become a trauma-informed organization while we're training our staff and living all of our mission to support our community's total health care needs. And again, anyone interested from the community, they can go on any of our websites to really learn more about our approach to care and find their closest location to their home. So on behalf of Access and our board of directors, I want to commend Mayor Lightfoot and the team at CDPH for their support of this critical initiative that recognizes the range of behavioral health providers who provide a continuum of care to address the wide range of needs of the communities we serve. Now, I would like to introduce Mayor Lightfoot.
Well, good afternoon, everyone.
Good afternoon.
Let me begin by thanking the folks who are here with us. If you look at the group that's been assembled, they reflect our communities. They reflect the great diversity of our city of Chicago, and making sure no matter who you are, what neighborhood you're from, you have access to community-based, community-driven, trauma-informed care. And that's what this is all about. So let's give a round of applause to all of our clinicians. We are today reaffirming this administration's commitment to investing in mental health care and announcing an expansion of our network of trauma-informed centers of care. Mental health plays a role in our everyday lives, of course. It can affect your ability to manage life's hard moments. It can change the way you connect with people and your outlook on life. And for too many of our residents, it can fuel community trauma. I have been a fierce advocate for mental health supports since my first day in office, and I have centered equity in the city's approach to mental health. The fact is, we inherited a mental health system with significant gaps, particularly in communities of color. Those gaps are connected to generations of disinvestment, the lack of a clear commitment and plan to ensure that all residents have access to care, and fundamentally, the continuing stigma when it comes to addressing mental health, the full spectrum. Now, the only way to close that gap in mental health services was to transform this broader mental health care system. We are already seeing tremendous results from that transformation. Through my administration's mental health equity framework, we have completely revamped our approach to mental health, launching a comprehensive grassroots strategy that meets people where they are. That plan is bolstered by $89 million investment in mental health through our 2022 budget. And to put this in context, that's a 7-fold increase from the investment in 2019. And it's the largest investment in mental health services in our city's history. Importantly, our framework is not a one-size-fits-all approach, which can only reach a few thousand people. We've developed a holistic strategy that can serve tens of thousands of Chicagoans by integrating and investing in a full array of mental health services through this community-based care. That approach is consistent with our values of equity and neighborhood investment. Because we know that communities of color have the greatest gap in care, we are channeling substantial new resources into these communities of highest need, primarily on the South and the West sides. And through our approach, we invested in a trusted network of community-based centers of care, reflected here by the individuals behind me. Today, we are here to announce an expansion of that network of trauma-informed centers of care. These centers provide health services regardless of immigration status, health insurance status, or ability to pay. Today's expansion brings us to 50 total community partners serving the mental health needs of our communities alongside of all of us. This investment began in 34 high-need communities. We announced that expansion in the fall of 2019 before the pandemic hit. But with our expansion, we'll begin offering services in all 77 community areas within the coming months. By integrating mental health services into existing trusted community clinics, we increase access to services while linking mental health and physical health care, treating the whole person. And I want to take a moment again to thank these representatives from the various centers who are standing with us here today. They are doing the Lord's work every single day. And let me also share the impact that these trauma-informed centers of care that we have seen so far. We've increased the number of residents receiving mental health services by 500%. Now, in 2022, the city is on track to serve 60,000 residents compared to just 3,600 in 2019. And just, again, to put that into context, at the height of all the city's clinics, we were serving around 2,500 residents a year. And again, this year, because of the partnership of all of these folks that are standing behind me, their commitment to people in the neighborhoods and making sure that everyone, regardless of ability to pay, insurance, immigration status, has access to high-quality mental health services. We're on track to serve 60,000 this year. And I don't have to tell anybody who's here in this room that the need for mental health services increased exponentially since the pandemic hit. And with this expansion that we're announcing today, we are prepared and able to serve all those who are in need. We also continue to invest in mental health clinics that are operated by the Department of Public Health, which has also expanded their services and hours of operation this year. Furthermore, we are bringing mental health services outside of the walls of the clinics to persons with complex needs. As some examples, for the first time ever, the city has added mental health professionals to our 911 system through our Crisis Assistance Response and Engagement, or CARE program. We know that every call for mental health services does not require a law enforcement-only response. We've heard that over and over again from residents, and we've answered that call, and you'll hear more about that in a moment. We've expanded the narcotics arrest diversion program to divert those dealing with substance use addictions away from the criminal justice system into the network of care that they need. We don't need people in jails. We need them getting help in the community and clinics. And I'm proud to say that Chicago's narcotics arrest diversion program is the largest of its kind in the nation, and the impact is proven. Initial evaluation findings of the program showed that there was almost a 50% reduction in future arrests by participants in our diversion program. That is an incredible record of success, but we're not resting on our laurels. We want to make sure that we do more to help those in need. But this is a prime example of evidence-based solutions making a meaningful impact. We will also provide mental health services through homeless shelters and on the CTA to ensure that harder-to-reach populations are also served. Finally, we are bringing trauma-informed care to people impacted by violence through historic levels of funding for street outreach and victim service teams that work in communities experiencing the highest rates of violence. Although accessing mental health care is just one component of building a broad system of care, we also need to dismantle the stigma around mental health, as I mentioned. Too many times, people do not seek help. Too many times, relatives, friends, and other loved ones who know that an individual needs help, is struggling, but are afraid because of the stigma associated with it to reach out and say, I need some extra support. I need help. So we've got to continue doing everything we can to destigmatize the challenges that many of us are feeling, and particularly heightened over these last few years. We need to make sure that people get the care that they need, and there are no barriers, no wrong doors for them to be able to get access to care. That is why we've launched the Unspoken campaign, which centers stories from actual Chicagoans who are bravely sharing their experiences. When you look at the number of people who stepped up to share their stories, you're going to see someone that looks just like you. You're going to see someone who has an experience just like yours. And we want people to know about this program because we don't want people to go untreated, uncared for. We want people to get the help that they need. If you want to hear about these stories, learn more about mental health, and find out how to access services, please visit mentalhealth.chicago.gov. That's mentalhealth.chicago.gov, or call 833-626-4244. That's 833-626-4244. Now, all of these mental health programs and investments are pieces of a broader and bold effort to address community trauma, poverty, violence, and addiction. We see these things as a necessary, holistic, root cause approach to the trauma that too many in our community are experiencing. We know that when we address people's health care, we improve outcomes for themselves and their communities, and reduce unnecessary contact with first responders, emergency rooms, and crisis systems. An accessible, affordable, and quality mental health care system will lead us to a safer and more compassionate city, and we need that in this time. So I want to thank all the leaders and mental health professionals who are with us here today and across our city, who are helping realize this vision for a city that is trauma-informed, where we reach out and look out for our most vulnerable, our neighbors, our friends. And I look forward to seeing the incredible impact that this work as it ripples across our city. Thank you again, one and all, for stepping up. And it's my great pleasure to introduce Deputy Commissioner of Behavioral Health, Matt Richards. If you don't know Matt, you need to get to know Matt. Matt is the behind-the-scenes guy that follows the data, that reaches out, that does the engagement, and makes sure that as a city government, we are on the right path when it comes to behavioral health of our residents. So thank you, Matt, for all that you do and your team. Please come to the podium.
Thank you. Thank you, Mayor, and thanks to everybody for being here today. I wanted to start by thanking Donna Thompson and the team at Access Community Health Network. Donna has indicated they have leveraged their funding from the city through this program to grow pediatric mental health services in multiple Southside community areas that have long needed trauma-informed mental health care, starting right here in New City. So thank you to you and your team for making that happen. I also want to thank all our partners. As the mayor said, we have 50 community mental health partners standing with us. These are federally qualified health centers, community mental health centers, community-based organizations across this entire city. And by this fall, we'll be delivering mental health services in every single community area in the city of Chicago. It's important to know that our network, our Trauma-Informed Centers of Care network that's standing behind us, delivers services, as the mayor has said, to every single resident, regardless of health insurance status, immigration status, or ability to pay. There is no wrong door in our network. I want to thank the folks standing behind me as well, that we recognize the work that you do is taxing. It is challenging as a social worker. I know it myself. And I think it's because of the incredible work that it has been so important since the mayor has taken office and shown leadership for the city, the state, and the federal government to work together in a really coordinated way to finally fund the safety net system. And the reason we knew we needed to do that is when we robustly fund the safety net system, the system that takes care of everybody, no matter your health insurance status, your immigration status, your ability to pay, we know you can pay your staff robustly. They have sustainable wages and benefits, and they can do the work and show up in the best possible way for their patients. I also want to thank our CDPH team. Whether you are working in one of our 5 CDPH safety net clinics, whether you are on one of our 911 response teams, whether you are on our safety net support team, I want to say it is an honor to be in this work with you. It is the highest honor of my career. I'm proud of each of you, and I'm excited for what we've done and what we're going to continue to do together. Finally, I need to thank the mayor. I have always said this is our mental health mayor. Mayor, as you will recall, this all started back in October of 2019 when you announced this framework on the South Side at Friend Health. At that time, you introduced a comprehensive mental health strategy for the city of Chicago called the Framework for Mental Health Equity. We said we would ensure mental health services were available in every single community in the city, that we would establish teams that would travel beyond the walls of clinics to some of our residents that were exposed to violence, that were experiencing homelessness, that were struggling with addiction. And for the first time, we would help coordinate the broader safety net system, which is something the city had never tried to do before, was to fund and help convene the safety net system. At that time, we didn't know what was coming. We sure didn't. We didn't know that a once-in-a-century pandemic was 4 months away, that it would compound long-standing racial and economic inequalities with which we had contended for generations. We didn't know we would see an unprecedented level of increase in our drug overdoses around the United States. We didn't know we would see historic levels of mental health distress among children and adolescents due to the disruptions in their daily routines and lives. At that time that you made the pledge that we were going to take this on, the mental health budget was $12 million. We were serving 3,600 residents, and we were serving no children in a city of 2.7 million people. We're almost here 3 years later, and Mayor, because of your support, that budget has seen a 7-fold increase this year to $89 million. As the mayor said, we expect to reach 60,000 people this year, a 15-fold increase since 2019. And maybe most importantly, we expect to serve 15,000 children under the age of 18 this year. Put very simply, our strategy is working. There is much more to be done, believe me, we know. But we also know that it is important to notice the advances that we have made. In order to support this ambitious vision, we have nearly doubled the size of the mental health team at the health department since the mayor has taken office, to a staff of nearly 100 people that just focus on mental health. They work in our safety net clinics, they answer 911 calls, they support the broader safety net system, and you'll hear from my colleague Vicki Romero in a moment, who is on that team. All of our mental health clinics have been renovated physically. Modern technology, we've hired new psychiatric nurse practitioners, new therapists, evening hours. We started a child and adolescent mental health team that had a child and adolescent program that had ended 20 years ago. Put very simply, Mayor, without your steady commitment and advocacy, this never would have gotten done. So thank you. In closing, with the new awards announced today, we will be able to ensure that mental health services are in all 77 of Chicago's neighborhoods by this fall. And I want to say, as a mental health professional, as a social worker myself, if you or a family member are in need of mental health support, please go to mentalhealth.chicago.gov. You can also call 311, or you can call our CDPH mental health intake line at 312-747-1020, and it would be our privilege to get you connected to what you might need. Thank you. There's going to be a video.
In the city of Chicago, certainly mental health awareness is very, very
We were just really fortunate that that funding came at that particular point in time and continued to sustain access to care. With the support of this grant, we were able to see more than 200 people during the course of the grant gain access to mental health services, and we were able to add a clinician as well as a community health worker.
The increase in the funding that the city has dedicated to mental health services greatly affected primary care health. We've always had some primary care behavioral health services, but we had always been wanting to expand and provide long-term therapy to our patients. We were able to hire 2 new staff. We saw, I think, over 400 patients last year. It really expanded our capacity to provide a wider range of mental health services to our primary care patients.
This accommodation helped us bring on a psychiatric nurse who really is instrumental in providing that triage services to our patients. Mental health is not just about coming to see your counselor or your psychiatrist for that visit. It's things that happen before the visit, things that happen after and before the next visit.
It's really important for us to be responsive. It's really important for us to be in the community, part of the community. There's just a lot of stigma around mental health. So kind of a lot of our work is destigmatizing the process, helping people understand that it's just part of their overall health.
The resilience, the strength of persons to fight for what they know they can be, with just a little bit of support from one of our mental health professionals, is so bright to watch because you literally see progress day after day, week after week, month after month.
Thank you.
Buenas tardes. La alcaldesa Lori E. Lightfoot y el Departamento de Salud Pública de Chicago anunciaron hoy que la ciudad de Chicago otorgará $3.1 millones en subvenciones para ampliar los servicios de salud mental para pacientes ambulatorios financiados por la ciudad en todo Chicago. Un total de 12 nuevos proveedores se unirán a los 38 proveedores existentes en la red de centros de atención informados sobre traumas de la ciudad. Los proveedores incluyen centros comunitarios de salud mental, centros de salud calificados federalmente y organizaciones comunitarias, que brindan una variedad de servicios de salud conductual para adultos, jóvenes y familias en sus comunidades. Las organizaciones en la red del TIC brindan acceso a servicios de alta calidad sobre traumas para todos los habitantes de Chicago, independientemente del seguro médico, el estado migratorio o la capacidad del pago. En 2019, la alcaldesa Lightfoot puso a cargo al Departamento de Salud Pública de Chicago para que desarrollara el marco para la equidad en salud mental, una hoja de ruta detallada para construir una red integral e integrada de servicios de salud mental en todos los vecindarios de Chicago. Este enfoque transformador incluye 4 pilares. El primero es la expansión de los servicios de salud mental para pacientes ambulatorios financiados con fondos públicos. Coordinación de servicios informados sobre trauma para personas afectadas por la violencia. También una expansión de programas de prevención y respuesta a crisis para personas que viven con enfermedades mentales graves y trastornos concurrentes. Facilitación de la coordinación del sistema para asegurar que los servicios de salud mental sean apoyados y coordinados en toda la ciudad. El marco estuvo acompañado por un aumento de 7 veces en fondos para los servicios de salud mental, de $12 millones en el 2019 a $89 millones en el 2022. Como resultado, se estima que 60,000 habitantes de Chicago recibirán servicios de salud conductual a través de la red de la ciudad en 2022, 1,500 aumento porcentual sobre las 3,651 personas que recibieron dichos servicios en el 2019. Los miembros más nuevos de la red TIC incluyen Ada S. McKinley Community Services Incorporated, Asian Human Services, Carolina Therapeutic Services Incorporated, Chinese American Service League, Envision Unlimited, Friend Health, Gads Hill Center, Infant Welfare Society, Inner City Muslim Action Network, Metropolitan Family Services, Pilsen Wellness Center, and St. Anthony Hospital. Trabajando a través de estos 50 socios comunitarios, el Departamento de Salud Pública de Chicago planea expandir los servicios de salud mental a las 77 áreas comunitarias de Chicago a principios del otoño. Además de crecer la red del TIC, el Departamento de Salud Pública de Chicago continúa invirtiendo en sus 5 centros de salud mental, incluida la renovación física de todos los sitios, el lanzamiento de servicios de telesalud y la expansión del horario nocturno, el lanzamiento de un programa de salud mental para niños y adolescentes y la contratación de un nuevo equipo de enfermeras, practicantes psiquiátricas y terapeutas clínicos. Para conectarse con los servicios de salud mental, favor de visitar el enlace mentalhealth.chicago.gov. Llame al 311 o llame a la línea de admisión de la Clínica de Salud Mental de nuestro Departamento de Salud de Chicago al 312-747-1020. 312-747-1020. Muchas gracias.
And before I take any questions, let me just add two other notes. People sometimes ask me, why do you do what you do? Why do you continue in this very difficult and challenging job and probably one of the most extraordinary times in our city's history? And it's moments like this, I get to bear witness to incredible people, incredible work, and know that we are doing profound things to make the lives of everyday Chicagoans just that much better. I will also say I want to lift up again the great work done by the Chicago Department of Public Health. You know, we all know them primarily through the extraordinary work that they've done to help keep us safe and informed during the pandemic. But I think as today's announcement underscores, there's lots of different component parts to our great Department of Public Health, including the folks in the behavioral health unit. These are folks who go to work every day, unsung heroes, but do incredible work on behalf of the residents of the city, and there are many like them across city government. I just want to thank them one and all.
Thanks a lot, Mayor. We'll kick it off with Christine Flores from WGN. Here you go.
So where does someone begin, right? If they want to, we see all the partners here behind you and they're seeking that help. This isn't going to happen overnight, but where do they start?
Hold on one second.
You okay?
Sit down.
Why don't we give her a seat? Why don't you take her chair? Well, what I would say in answer to your question is this. Number one, this isn't something we're starting with a blank piece of paper. As you heard, we announced this new approach to delivering trauma-informed, community-based care in the fall of 2019. And we started then with 34 communities, 34 different partners in the community. We're now expanding it today to 50. And as you heard from Matt Richards, our hope is that by the end of the year, we're going to be in every single one of the 77 communities. So to be clear, these folks have been doing this work. Right? They've been doing this work for a long time, in many instances for decades. But what we have attempted to do is be more intentional and coordinating and making sure that we're letting people know that the services are actually available right there in your community. And that's the difference. And then obviously supplying resources to help expand the opportunity to reach more individuals regardless of citizenship status, insurance, or ability to pay. That is the difference. So expanding the network, so making it a real network and not individual clinicians that are operating in silos. This is a body of work. This is a center and a network of care that we're going to continue to make sure that we support, because by supporting them, we're supporting our residents who have needs.
Thanks, Mayor. That's a wrap, everyone. Have a great day.
Thank you.